In May, the Department of Health said they were adding 30 contact tracers, and Governor Ige said he was confident that we had enough. But even then, many of us knew we didn't have nearly enough. That same month, the Department of Health partnered with UH to create a contact tracing training program. The governor thanked the Hawaiʻi congressional delegation for $50 million of funding to go towards contact tracing and testing. In June, we were told the Department of Health would train over 300 people to do contact tracing, and that they had 60 people on staff. Now in July, just last month, we heard different stories coming from Dr. Park and Dr. Anderson. In mid-July, they said 179 active contact tracers were at work. At the end of July, that number was 77. Just a week later, they reported there were 105 active contact tracers. No explanation for the discrepancy in these numbers, and what we know to be true today is that all of these numbers were a lie. Last week, there was a surprise visit of our state senators who went and visited the Department of Health. They found that there were less than 10 contact tracers for the island of Oʻahu and a total of 15 statewide. How is this possible? Our state leaders and the Department of Health have the money, they have the people, they have the guidelines for how to get the job done. And yet, they have failed. They've known for months the need to prepare for this exact situation that we are facing, with incredibly high numbers of coronavirus impacting the people of Hawaii. They spoke themselves of the need to be prepared for this situation, and yet they have failed. To top it all off, they have lied to the people of Hawaii all along, saying, "Don't worry, we have it under control," when in fact the opposite is true. As a state, we have gone from having some of the lowest numbers, the fewest cases of coronavirus per capita in the country, and proud of the sacrifices and the work that the people of Hawaii did that made that possible. Yet today, we are the most infectious state in the country. Much of this can be attributed directly to the fact that, in effect, we have had almost no contact tracing at all, because the few people who are doing this difficult task across our state are so completely overwhelmed that they are unable to do the job that they have been given. Many people who have been exposed to COVID-19 are still waiting for a call from the Department of Health. So here's the question: what has changed as a result of all of these failures? Nothing, really. The very same people who have been lying to us for months now still have their positions and they still have their jobs. As recent as yesterday, Governor Ige said he has total confidence in the State Department of Health's Director, Bruce Anderson, and the state epidemiologist, Sarah Park. This is astounding to me. My question is, what will it take for our state leaders to actually fight for the people of Hawaii? To put their interests ahead of any other interest? How many more people need to die until appropriate action is taken to preserve and protect the health and lives of the people of our state? Now today, you're going to hear from a brave Department of Health employee who has courageously come forward to tell the people of Hawaii the truth about the impacts of this failure of leadership in our state and how the health and lives of the people of Hawaii are being impacted as a result. She has been working to, along with her colleagues, to raise the alarm bells within the Department of Health for months about the direness of this situation and about how she and her colleagues who have been tasked with contact tracing are unable to fulfill this impossible task because there aren't enough of them to do it. She's here today because she felt she had no other option available to her than to speak out publicly, even at risk of potential retaliation or losing her job. I want to introduce now Dr. Jennifer Smith, She is an epidemiological specialist, influenza surveillance and response coordinator in the Hawaii Department of Health's Disease Investigation Branch. She's been working in this job since 2016 with an expertise in virology, dealing with the very pandemic that we're dealing with. She is one of less than 10 case investigators tasked to conduct contact tracing on the island of Oʻahu.
So we were asked by leadership on a daily basis how many cases could we interview. We told them 3 at the most. Given that, again, contact tracing is just a portion of what we're doing. So our job, number 1, is to contact the person who tests positive and determine where they may have been exposed. Secondly, we get a list of their close contacts. So we determine then who they may have exposed. And finally, we need to recommend prevention and implement control measures, such as quarantine and isolation. There are a lot of peripheral tasks that we've been asked to take on, as well as that. We were told we should do at least 5 cases a day. That's great when we have one person who may not have traveled, who doesn't work, who lives alone. But when I have a family of 22 people, that is an enormous undertaking for one person. And that would take me away from other cases for several days. And I have sat there. I came in on a Tuesday. I had 22 cases in my queue. By Wednesday afternoon, I was up to 47. And on Thursday, as I sit and watch the numbers tick up, 56, 57, 58, 59, I got so overwhelmed and panicked. And I just had to leave. I had a panic attack. I didn't know where to start. I didn't know what to do. All of these people deserve the same attention and care that all of the other cases have received. I think we all understand there are definite challenges. We have all been yelled at, hung up on, berated, threatened with legal action from cases. We have a lot of people who fail to tell us where they work, who they've had contact with. There are a lot of challenges. We have people who don't have phones. We have people who don't answer their phones. We have people who don't call us back. So there are definite factors that impede the investigation.
Would we be standing here today without Dr. Smith? The answer is no. And this just points to, again, the lack of transparency and honesty in the information we have all been given from the Department of Health thus far. And the reality that, and I was really shocked by this, but when the state legislators went and showed up at the Department of Health unannounced, the public response by Director Bruce Anderson was one of anger, as though they had no right. I think he actually said that publicly. They had no right or something along those lines. These are elected leaders charged with the responsibility of oversight of our state departments, including the Department of Health, and they're responsible for funding. Of course, they have every right to walk in there at any time to be able to see what's going on. And the response from Dr. Anderson and Sarah Park to me, expressing their anger, was indicative of the problem of leadership, where you have people who believe that they are somehow not responsible to the people of Hawaii, and that they are only responsible unto themselves. And that's a very dangerous thing when you have people who have such a tremendous responsibility. With contact tracing, the emphasis that we're putting on this here today is one of containing and defeating this virus. But I know there are conversations going on about potentially lifting the 14-day quarantine on September 1st, as long as people have this COVID test. The details that have been put forward by the governor, the only way we can get to a point where we can lift that 14-day travel quarantine with these testing requirements is if we have a robust contact tracing program in place. It's the only way it's going to work. Without that, what to speak of the crisis we're facing here, but without that, any conversation about lifting the 14-day travel quarantine really is a moot point.